Okay, today I'm going to start the stomach and duodenum. Okay, the stomach acts as a reservoir for ingested food where it is mechanically broken down and the process of digestion begins before the ingested part passes into the duodenum. So the stomach is a reservoir for ingested food like the food we ingest is stored temporarily in stomach and then it is mechanically broken down and the process of digestion begins before the digested content passes into the duodenum. Next we will discuss about anatomy of stomach and duodenum. First we will have a look of blood supply, then we will see the lymphatics, and then we will see the nerves. So let's start with blood supply. Now the stomach has an arterial supply on both lesser and greater curves. So this is lesser curve and this is greater curve. On the lesser curve, the left gastric artery, which is the branch of celiac axis, forms an anastomotic arcade with right gastric artery, which arises from common hepatic artery. It means that the left gastric artery from celiac axis forms an arcade with the right gastric artery, which is a branch of common hepatic artery. Yes. Now, next, the branches of left gastric artery pass up towards cardia. So it is mentioning that the branch of left gastric artery also moves towards cardia. Now this is the cardia. So branch moves toward itself also. Next we have the gastroduodenal artery, which is also a branch of hepatic artery, passes behind the first part of duodenum, and this is highly relevant with respect of a bleeding duodenal ulcer. Okay, so the gastroduodenal artery, here we have this one. Gastroduodenal artery arises from hepatic artery, passes behind the first part of duodenum, and this is relevant in bleeding duodenal ulcer. Bleeding duodenal ulcer. Okay, so next, okay, the here it divides in superior pancreaticoduodenal artery and the right gastroepiploic artery. So it is saying that the gastroduodenal artery behind the first part of duodenum divide into superior pancreaticoduodenal artery and right gastroepiploic artery. And the superior pancreaticoduodenal artery supplies the duodenum and pancreatic head and forms an anastomosis with inferior pancreaticoduodenal artery, a branch of superior mesenteric artery. So this pancreaticoduodenal artery forms an anastomosis with inferior pancreaticoduodenal artery, which is a branch of superior mesenteric artery. And next is the right gastroepiploic artery that runs along the greater curvature of stomach, eventually form an anastomosis with left gastroepiploic artery, which is a branch of splenic artery. So it's saying that the right gastric epiploic artery, which was a branch of gastroduodenal artery, forms an anastomosis with the left gastroepiploic artery, and this left gastroepiploic artery was the branch of splenic artery. So splenic artery, which arises from common celiac artery, give rise to left gastroepiploic artery, and the right gastroepiploic artery, which is the branch of gastroduodenal artery, forms an anastomosis around greater curvature of stomach. Now this vascular arcade is important during construction of gastric conduit in esophageal resection, is often variably incomplete. Next is the fundus of stomach is supplied by vasa brevia, which arise near the termination of splenic artery. So it's saying that the fundus of stomach is supplied by vasa brevia or short gastric artery, which arise from near the termination of splenic artery. Now this is splenic artery, and at its termination it gives rise to short gastric arteries, and from short gastric artery vasa brevia arises, and this supplies the fundus area of stomach. Now moving to next, we have veins. In general, the veins accompany arteries, and those along the lesser curvature drain into portal vein, and those on greater curve drain into splenic vein. So we have two types drainage: lesser curve to portal vein and greater curve to splenic vein. Next, on the lesser curve, the coronary vein is particularly important, and this runs along the lesser curve towards esophagus and then pass left to right to join the portal vein. These veins become markedly dilated in portal hypertension, and here there is no picture of coronary veins. Okay, so again, on lesser curve we have an important vein which is coronary vein, and it runs along the lesser curve toward esophagus and then passes left to right to join the portal vein, and this veins dilated in portal hypertension. So coronary vein dilation in portal hypertension. Next we have lymphatics. The lymphatics of stomach are considerable important in surgery of gastric cancer and described in detail in that section. Oh, which means if we need to look for the lymphatic of stomach, we have to study in chapter some in section of surgery for gastric cancer. Okay, so leave this for some other time and move to nerves. Okay, the stomach and duodenum possesses both intrinsic and extrinsic nerve supplies. The intrinsic nerves exit principally into two plexus. Wow. The mentoric plexus of Orbeck and the submucosal plexus of Meissner. Compared with rest of gut, the submucosal plexus of stomach contain relatively few ganglionic cells, as does the mentoric plexus in the fundus. So, mucosal plexus of stomach contain few ganglionic cells and the mentoric plexus in fundus. However, taham, in the antrum of the ganglia of mentoric plexus are well developed. So in antrum the ganglions are well developed, but in submucosal, okay, next is the extrinsic supply is derived mainly from the vagus nerve. It's grade number 10. Fibers originate in brainstem. Okay, the vagal plexus are round. The esophagus condenses into the bundle that passes through esophageal hiatus. The vagal, this is one important MCU. The vagal plexus around the esophagus condense into the bundle that passes through the esophageal hiatus. Like I believe this was the T12 level where the esophagus passes along with vagus nerve. The posterior bundle being identified as a large nerve trunk. Vagal fibers are both afferent and efferent. The vagal fibers are both afferent sensory and afferent. The afferent fibers are involved in the receptive relaxation of stomach and the stimulation of gastric motility as well as well-known excretory function. Okay, though if vagus nerve as afferent is for relaxation of stomach, the stimulation of gastric motility, receptive relaxation, and for well-known excretory function. The sympathetic supply is derived mainly from celiac ganglia. Yes, yes. Okay, so let's revise the nerves. The stomach and duodenum have both intrinsic within the stomach and extrinsic outside the stomach nerve supply. The intrinsic nerves exit principally into plexus. The intrinsic, the extrinsic. The intrinsic from enteric plexus and Meissner, which is a submucosal plexus. The submucosal plexus of stomach contain few ganglion cells and mentoric plexus contain few ganglion in fundus. But in antrum, the ganglia of mentoric plexus are fully developed. So fundus is a relatively ganglionic area and the antrum is fully developed. And in extrinsic supply, like here intrinsic, we discuss intrinsic, and there we have extrinsic supply, and it is from vagus nerve, which comes from brainstem as a 10th nerve, and it passes from T12 along with esophagus, hiatus, and these efferent fibers are involved in receptive relaxation of stomach, the stimulation of gastric motility, and well-known excretory function. And that's why we use vagotomy as an anti-excretory procedure. Next we have microscopic anatomy of duodenum. Here we will discuss about parietal cells, chief cells, endocrine cells, and we will discuss about duodenum. Then we will move to physiology of stomach and duodenum. So up till here we have anatomy. Like first we discuss about the anatomy, then here we will discuss about the microscopic anatomy. Okay, so the gastric surface epithelial cells are mucus producing. So the gastric surface epithelial cells are mucus producing. Mucus secreting glands are found also in duodenum. The specialized cells of stomach, parietal and chief cells are found in gastric crypts. The stomach also has numerous endocrine cells. So first we will discuss about the parietal cells, then chief cells. Now the parietal cells are found in the body of the stomach and the line of gastric crypt, being more abundant distally. They are responsible for the production of hydrogen ion that from hydraulic acid. So the parietal cells, which are the acid producing cells, are found in stomach and the line of gastric crypts, being more abundant distally, and they are responsible for production of hydrogen ion that form hydraulic acid. The hydrogen ion are actively secreted by hydrogen potassium ATPase proton pump, which exchange intraluminal potassium for hydrogen ion. Yes, obviously the potassium ion enter the lumen of the crypt passively, but the hydrogen ion pumped against an immense concentration gradient. And we have proton pump inhibitors act by blocking this sodium potassium ATPase and therefore significantly reduce gastric acid. Now we will discuss about this PPS somewhere later, but it's saying that for hydrochloric acid formation, the hydrogen actively secreted by hydrogen potassium ATPase pump, which exchange intraluminal potassium for hydrogen. So potassium out, H plus in, and this is done by hydrogen potassium ATPase pump, and the potassium enter the lumen of it passively, but the hydrogen are pumped against an immense concentration of potassium itself can be entered without any help, but for hydrogen it needs the help of sodium potassium ATPase, and this is blocked by proton pump inhibitors. Okay, so after the acid producing cells we have next chief cells. Let's see what chief cells does. The chief cells lie proximally in the gastric crypts and produce pepsinogen. Okay, the parietal cells were more distally, but the chief cells are more proximally. Two forms of pepsinogens are described. One is pepsinogen 1 and pepsinogen 2, and the ratio of pepsinogen 1 and 2 in the serum decreases with gastric atrophy. Pepsinogen is activated into the stomach to produce digestive protease pepsin. So they wrote very little about chief cells. One, that it produces pepsinogen, and then pepsinogen is pepsinogen 1 and 2, and the ratio of pepsinogen 1 and 2 in serum decrease with gastric atrophy. Obviously, if gastric atrophy, then decrease enzyme, and the function of pepsinogen is the pepsinogen is activated in the stomach to produce digestive protease pepsin. Okay, so pepsinogen, pepsin making protein. Okay, so after chief cell we have some endocrine cells. The stomach has numerous endocrine cells. They mentioned this in here, that stomach has also numerous endocrine cells. So let's talk about endocrine cells of stomach. The stomach has numerous endocrine cells and they are critical to its function. In gastric antrum, the mucosa contains G cells which produce gastrin. So endocrine cell first. We will see about the gastric G cells which produce gastrin. Then throughout the body of stomach we have enterochromaffin like cells, and they produce histamine, which is the key factor for driving gastric acid secretion. So we have second ECL cells for gastric acids for producing histamine, which is also histamine, which is a key factor in gastric acid secretion like HCl secretion. Next is we have, in addition, there are large number of somatostatin producing cells throughout the stomach. So we also have D cell throughout the stomach. First we have G cell in gastric antrum, then we have throughout the body ECL cell, also we have D cell throughout the stomach, and D cells is somatostatin producing cells. Now the somatostatin has a negative regulatory role. The peptides are neuropeptide produced in stomach are discussed in gastric acid secretion. So we will discuss about them in gastric acid secretion later on. Next we have duodenum. The duodenum is lined by mucus secreting columnar epithelium. In addition, Brunner glands lie beneath the mucosa and are similar to pyloric gland in pyloric part of stomach. Endocrine cells in the duodenum produce cholecystokinin and secretin. So we have duodenum that is lined by mucus secreting columnar epithelium. So the epithelium of duodenum is columnar epithelium, and they have Brunner glands beneath the mucosa and similar to pyloric glands. So they are similar to pyloric gland in the pyloric part of stomach. And the endocrine cells in the duodenum produce cholecystokinin and secretin. So cholecystokinin and secretin are the hormones of duodenum. Next we have physiology, and we will discuss about physiology in our next session. So let's stop right now. We will discuss about physiology in our next lecture.